And then one other data point here that I found very interesting, all in attempts to provide you the appropriate context for how we think about these different interventions, looking at what's known as the Hamilton Depression Rating Scale. If we look at SSRI medications, selective serotonin reuptake inhibitors, one study, and this was a meta-analysis of 131 randomized control trials, they found a 2-point reduction on depression, which is significant. However, a clinical trial found that sauna therapy led to a 4 to 6 point reduction in depression. I also want to be really careful to state that the SSRI data comes from a meta-analysis of 131 randomized control trials with hundreds of thousands of patients. The sauna study is one clinical trial in about 30 patients. So this is not an apple-to-apple comparison, but it's just to provide you, if you yourself or someone you love is suffering with depression, the data to understand that there are multiple ways to improve that. And perhaps what we can do is put these in a semi-linear interventional hierarchy, starting with something like exercise and sauna if you have access to it, amongst other therapies, but just as a few. And maybe if you've had prior trauma, you use some sort of CBT or limbic retraining therapy first. And then if you're not fully seeing the response that you'd like to see, this is when you can check in with your doctor and consider a conversation about antidepressants. Again, context matters, so take this all with a grain of salt. But this is to hopefully help impress upon you that there are many different options for depression.